For health professionals, knowing how to perform under pressure can literally be a matter of life or death. My name's Alex Young. I'm a trauma and orthopedic surgeon by training. I also sold a company as a medical student and scaled a previous education company internationally in my spare time around my NHS commitments. I founded Virti as there's no way to reproduce the stress and emotion of real clinical practice and no way to scale in-person training. At Virti, our mission is to make experiential education affordable and accessible to everybody on the planet, beginning with healthcare. Now, as a physician myself, I can tell you that the first time that my skills were truly tested under pressure was the first time that I encountered an acutely unwell patient. Now, for all of you as potential unwell patients going into hospital in your region, how does that make you feel? Well, it's a massive patient safety concern and one of the biggest unmet challenges of our time. With medical error, the third leading cause of death in Western hospital systems, causing upwards of 250,000 deaths in the US alone each year, and costing health providers 20 billion in payouts on errors every single year. To mitigate against this, providers spend $2.7 billion on mandatory in-house skills training with no way to reduce these costs or to scale their education beyond their four walls. In developing countries, such as the 47 of sub-Saharan Africa, 11 don't have any access to medical training at all, including soft skills training, communication, and technical skills. At Virti, we solve this enormous problem by using virtual and augmented reality technology coupled with artificial intelligence to transport our users into difficult-to-access clinical environments and safely assess them under pressure to improve their performance and to reduce error. The system is truly scalable, and we've even built out a creation suite for our educators. Educators can use soft skills training that they create or technical skills training, all from our web-based dashboard, which is able to collect unique analytics on user behavior across a wide range of skill sets and uniquely assess them so that they can assess their workforce across every single compliance discipline you can possibly consider. Now, one of the things we're very proud of is that everything I've just shown you has been validated through rigorous evidence. Across the whole of the platform, we have shown that we can improve performance by up to 75%, reduce the time taken to train employees by 40%, and most importantly, save the cost of training by up to 33% per organisation. Now, we sell across the NHS, and that's one of the most difficult customers to sell into at an enterprise level. Today, we sell into over 400 different sites just in the UK alone, regardless of our enterprise customers in the United States. And to do that, we've created robust, evidence-based research demonstrating how our platform works and the different learning models. In fact, we've been so successful with our research that we've won a number of different awards. Most recently, the British Orthopaedic Association's Simulation Paper Prize, where we demonstrated that using our platform over a 6-month period would actually reduce stress, anxiety, and burnout levels in physicians, which is quite amazing. Highlighting this, we're the only education company and certainly the only virtual reality company to be selected to be part of the NHS's National Innovation Scale Programme, which recommends hospitals to buy selected products. And around that, we've also demonstrated health economics data showing savings of upwards of £300,000 per year per institution on the costs of training. Now, behind all of our tech, we've got a world-class team. We now have a team of 16, but some highlights include our BAFTA-nominated Unity developer. We've got PhDs in computer vision and AI, and we've also got our CTO who previously hacked videos into the front end of the Pirate Bay. Everything I've just told you, we've achieved over the last 2 years. We were founded in July 2017. We've raised over $2 million in venture funding from investors in Silicon Valley and from Europe. We've scaled throughout the NHS and are due to be rolled out even further in 2020. We have over 60,000 users across our UK platform alone, regardless of US, And we also have large US customers, including Cedars-Sinai over in Los Angeles, and we've just started working with Boston Children's Hospital and the Texas Medical Center. We're excited to be back in Europe to pick up some further enterprise deals, including those with device manufacturers. And if you're interested in scaling your workforce education offerings, we would love to hear from you. Thank you very much.
All right, round of applause.